Good morning. Welcome everybody to our second seminar for my session for the Research Seminars Network Series. I am going to pass straight. My name is Claire Curtis. Apologies, I'm the Engagement Programmes Manager for the West of Scotland and the Participation Network within Healthcare Improvement Scotland's Community Engagement Directorate, and I'll be the host today. You will see some of our colleagues in the background and on screen. So I'm just going to pass over to Alan and Ashleigh and let them introduce themselves. Have a good session. Please remember it's being recorded, put the links in the chat.
Thanks, Claire. Hi everybody, I'm Ashleigh Spalding. I'm an improvement advisor on the person-centred design and improvement team, which lies within the people-led care portfolio in the iHub. And I'll just pass over to Alan.
Hi everyone, name's Alan Bigham. I'm Senior Programme Manager. I work with Ashleigh and colleagues on the new Models for Learning Disability Day Support Collaborative.
Thanks, Alan. And I guess we'll just get right down to it and start our presentation on engaging with people with learning disabilities. And this work has very much come from the work that Alan referenced there around the new Models of Learning Disability Day Support Collaborative. And so I'll be taking you through the presentation, which will involve some audience interaction via Slido before Alan comes back and joins us again for the Q&A discussion. And it's just a wee bit of a heads up at this stage that what you're going to find is that this work is still very much in a very exploratory phase. And so when it comes to that Q&A section, we would really welcome your thoughts around some of the challenges we highlight throughout the presentation. And so, as I said, we're going to be using Slido for some audience interaction today. The link should be getting posted in the chat box, but alternatively, if you've got your phone handy, you can scan the QR code on the screen using your camera, and that'll take you to it. And you're just using that joining code there, the 483852. So those links will come up again when we actually get to the Slido section of this as well. So that'll be there shortly. But moving on, and I'm just going to start off by giving you some background. So there are an estimated 120,000 people in Scotland who have a learning disability, and around 26,786 adults who have a learning disability known to local authorities across Scotland. And you'll note I use the words estimated and around to describe these figures, which is a point I'm going to come back to later in the presentation. And so support and services for people with learning disability have changed quite drastically since the early 2000s when the Same as You strategy was introduced. Prior to this, learning disability support and services had predominantly been based in institutional settings away from local communities. And over the next decade after Same as You was introduced, support and services developed taking a human rights-based approach, changing the outlook of support to being based around community inclusion and enabling individuals to realise and achieve their aspirations. And so in 2013, the Keys to Life strategy was introduced, replacing but building off of that human rights-based strategy emphasised in Same as You. And the Keys to Life set out 4 strategic outcomes for people with a learning disability in Scotland: for them to have a healthy life, to have choice and control over their options in life, to be able to live independently, and to be able to be active citizens within their communities. And so while these outcomes set out are really positive aspiration for the future of people with learning disabilities, their core purpose is in addressing inequalities which affect people with a learning disability, which despite best efforts of national and local strategies since the early 2000s are still really prevalent now. And I guess in terms of inequalities, having a learning disability is a protected characteristic in itself, but there is that potential for further protected characteristics to be relevant within this group. And in addition to that, looking at the unpaid carers role, well, that isn't a protected characteristic. Some unpaid carers will have protected characteristics themselves, and they can also be negatively impacted due to their association with the person with a disability. So these are really important things to be considering when we're talking about meeting the outcomes of Keys to Life. as it kind of drives a bit more complexity around simply making sure that people with learning disabilities can live a healthy life, for instance. And we know that these haven't really been met to their full potential so far. For instance, there are still health inequalities for people with a learning disability in terms of accessing services. Current social services processes limit the choice and control a person can have over the options for support to live their life as they want. There are still significant barriers to employment, and independent living is not yet the norm for people with learning disabilities. And they're also not yet fully able to participate in community activities for a variety of reasons. And there is variation within this, as not everyone with a learning disability is the same. Whether a person's learning disability is mild, moderate, or profound has a significant impact on to what extent the keys to life outcomes are met for individuals. Additionally, factors such as geography and affluence have a massive impact on the opportunities for people to achieve these outcomes. So basically, there's still a lot of work to be done. And in 2019, an additional Keys to Life implementation plan was published to further support local authorities and support providers to achieve the outcomes of Keys to Life, highlighting the need to adopt a whole system, whole population and whole person approach to improving the lives of people with learning disabilities. So I guess now on to where we are now. There has been progress, with most people with a learning disability now living in the community, with 62% of people in mainstream accommodation and 14% living in supported accommodation. The aims of person-centred care and self-directed support have been seen as positive developments in enabling people to have choice and control in their lives, contributing to the rise in aspirations for people with learning disability, particularly amongst younger people and their families. However, as I noted earlier, there's still a lot more work that needed in this respect. So rates of employment have not improved and are consistently lower than the average for disabled people overall. Access to health services and a reduction of health inequalities still exist, hasn't yet been achieved even. Access to quality housing really impacts on people's ability to live independently. Support for parents and carers is a consistent issue, and kind of balancing the rights of the individual versus the rights of their parents or unpaid carer is a consistent tricky subject for anybody trying to improve how services currently run. And also there's issues around realising more complex long-term ambitions such as parenting and long-term relationships, which are, I guess, second nature for those of us without a learning disability, but for them, when you bring in adult support and protection legislation, for instance, can result in a minefield for something that's quite simple for other people. And then there's a constant elephant in every health and social care room right now, which is the sustained budget pressure limiting what can be done and the capacity services have to undertake alternative ways of working. Additionally, the benefits of health and social care integration, which would contribute to that whole system approach mentioned in the Keys to Life implementation plan, have not yet been realised. And the final bit of background, the pandemic and its resulting lockdowns have exacerbated every inequality issue people with learning disability and their families already experience. With support provision cut for all those but with the most critical needs, the closure of building-based day services, which are only just now opening back up in a limited capacity, less access to healthcare services, no respite for families, and the isolation we all experience to some degree. People are exhausted and feeling like they've been forgotten about and worrying about what the future post-COVID will look like. So just so that you're not ending up with me talking at you for ages, we're going to go into our first Slido question, which is about how are people with a learning disability being considered within your stakeholders? Regardless of what part of the system we're trying to improve upon at this point, people with learning disabilities will probably need some access, whether it's your GP, your district nurses, even in the hospital talking about ambulance services or urgent care. People with learning disability do also need access to this. So just wondering, regardless of what project it is you're working on, have they been considered and how? And again, you can just use that QR code that's on the screen there, and the link has been posted into the chat. And we'll just give this a couple of minutes. EQIA, always a good one. I know there's quite a lot of work being done within Healthcare Improvement Scotland around the EQIA. There is an improvement project around that process now as well. Requesting everything in easy read. Definitely something we've also been considering within our work. Gathering news for the redesign of urgent care. Don't know. Okay, so there's quite a lot going on considering community hubs in East Lothian. Oh, and detecting the risk of type 2 diabetes and LD, very specific topic. Okay, brilliant. So there is quite a lot going on there. So I guess as we go into the next part of the presentation, what I want you to think about is how much control, I guess, we in Healthcare Improvement Scotland or as external participants in this and trying to improve services, how much support we need to give to the actual services to do engagement work at a level that actually allows people to kind of share their views and have those properly considered when we're going through redesign work. So just keeping those thoughts in mind, and also just how you maybe go about this. What methods do you use, whether it's communication tools or specific research methods that help you kind of uncover or work with people with a learning disability? So sorry, quite a lot to keep in mind, but we'll move on for now and just let those thoughts swirl in your head as we go through this next part. Because now we're going to go on to what we've actually been doing around this work and how this relates to engagement with people. So from October 2020 to May 2021, Healthcare Improvement Scotland's iHub was commissioned by the Scottish Government to deliver a collaborative for health and social care partnerships to reimagine what day support services might look like and explore this together. The key drivers for this work were around ensuring a range of support options are available to enable adults with a learning disability to have choice and control over how they live their lives, a request from health and social care partnerships to enable a co-produced approach to the review and redesign of day support, the impacts of COVID-19 on both supported people and their families, and a review and restructure of learning disability day support being included in health and social care partnership strategic plans. There are more, but this gives you the general gist of the key drivers for this work. And so the 8 health and social care partnership teams featured here applied and were accepted to be part of the collaborative. And each included participation from the independent and third sector, as well as carer representation from a professional capacity in some of the teams. Our team aimed to take them through the discover and define stages of the Scottish approach to service design, and that's that double diamond image that you see there in the screen. And part of the reason for choosing this approach was around the request for something which enabled that co-production, and that's exactly what that first diamond is really about. So the first part of the diamond is discover, and discovery is about researching the experience of the current state. So engaging and working with users and their families to understand what they are experiencing right now, challenging us to find the gaps in our knowledge and what we think we know about what people want. And as you move into the define space, it is about working with the users and their families to do some form of collaborative sense making of what you know now based on the discovery activity, and define the key areas of focus for moving into the develop and deliver stages. These 2 stages very much sit in what is called the messy space of design thinking, acknowledging it is necessary to sit in the complexity of a problem you're trying to solve, gather as much information as you can, and explore every avenue to ensure you're designing the right thing before designing the thing right. And I think some links will be getting posted in the chat if anybody wants to know more about the Scottish approach to service design. And so now on to more of what we actually did to achieve this. Well, the first part of the collaborative involved delivering a series of front-loaded learning sessions where teams undertook activities to help them gain skills in using specific tools for their discovery work. The first was a deeper dive into what the discovery stage of the Scottish approach to service design actually is, where we facilitated and captured a discussion where teams around where teams are now in that double diamond. And interestingly, while many acknowledged that they did not yet fully understand their user needs or have done the engagement work to gain that, and that they didn't know what any of that would mean for moving forward, as many, if not more, felt that they were already at the developed stage of the Scottish approach to service design. These team members felt that they had already undertaken significant engagement work and that they were already developing and delivering new ways of working based on what their users really wanted. And so next we introduced what's called the ISM behaviour model, and Alan will Stuart will post a link to this into the chat, because I know there's a few different ISM variants floating about, but what this variant of ISM is about is exploring context in terms of what it means for individuals, for groups, and for systems. And so we showed this to the teams as a tool for mapping the knowledge that project teams already had and identifying the gaps in their knowledge. The reception to the ISM at this stage was really quite varied, and possibly because one of the things it highlighted was the lack of evidence for knowledge that teams had. Most information provided was very anecdotal rather than being linked to what pieces of engagement work had told them. It prompted the question of what has been done with previous engagement data. For teams who had identified themselves as being in the developed stage in the previous session, this was actually quite a telling thing, and kind of made them think a little bit more about what actually they had gathered and how they were using it. And next we moved on to the ladder of co-production. And again, there'll be a link posted to this in the chat. But this is where teams were asked to map their key stakeholders against this ladder, which basically gives you the scale of co-design, co-production, all the way down to essentially coercion, educating, informing people. And for every team, the users of services were sitting much lower on that ladder than where they wanted them to be, prompted the question of, are our current methods of engagement with users actually fit for purpose? And finally, we facilitated a red rules, blue rules discussion with the teams. Now, this is basically thinking of different rules within your organisation and sorting them into either red rules, which are rules that cannot change. They are rules that we have to follow for a legal reason, for instance. Whereas blue rules, on the other hand, are more about organisational norms and culture. So they're not set in stone, but shaped by social factors in our organisations. And again, the topic of how we engage with people who use services came up. And while there were some red rules, for instance, GDPR, around how we engage, the actual process and structure of engagement was identified as the blue rules, something which could be changed, and was not currently set up to support the level of collaboration needed to achieve with their service users and their families. So they went through quite a lot of thought processes in that, and we followed it up with individual team coaching sessions. And again, within these sessions, following what we'd found out in the initial learning sessions, what we found is a lot of teams were asking us to do a bit of a deeper dive into their actual engagement processes to assess just how well they were actually working. And so one of the things that we did for this was user journey mapping with a few of the teams. And this type of user journey mapping is very much a kind of design version of it. But it starts with asking teams to think about how their service users become aware of engagement opportunities. And while teams were able to identify a variety of methods to communicate engagement, it became apparent just how reliant this part of the process was on word of mouth from both staff and services and peers who were already in the loop. Begging the question of, is communication of these opportunities wide enough to engage those who are not currently in contact with services? Next, we asked teams, how do service users agree to join engagement opportunities? And this one was really interesting because it actually kind of stumped the teams and made them recognise that this was quite a weak point in their process. People would receive information in that aware stage and have little to no contact regarding it until the actual engagement event took place. meaning teams weren't actually all that certain of how effective their aware point of the process was, nor how effective their use point of the process was going to be. Moving on to how service users actually use engagement opportunities. Well, transport to the venue was highlighted here. Often users are asked to attend a venue of some form to participate, at least pre-COVID. And this created the question of how do people actually get there? And are these building venues actually accessible for people at points? How much have we actually looked into that? Similarly, in the current digital climate, it was recognised that people rely on having digital skills and access to IT to actually participate if things are done virtually. And so again, you might be cutting off a whole branch of your service users from actually participating in your engagement activity just by not fully considering your approach. Another issue was around if a survey needed to be filled in, for instance. So even if it's an easy read, there are barriers for people with a learning disability actually being able to complete these from their own point of view and not the point of view from their families and carers who might be supporting them. So again, that balance between the family's point of view versus the needs of the person kind of coming into light again. And they reflected that these opportunities should be safe spaces which enable a person to talk about what matters to them, and that right now services tend to ask the questions that they want to ask, limiting the responses that they can get and the ability to dig deep into what would actually make a difference to the lives of individuals. And on this basis too, teams recognised that people were tired of answering the same questions over and over again. There was also some reflection around the communication tools and having trained staff in place to enable individuals with more complex communication needs to participate and have their voices heard to the same degree as everybody else. So a lot to unpack in that stage, but next we spoke about what people should be gaining from these opportunities. And for this, for the most part, these answers were actually aspirational rather than things that services could demonstrate they were doing right now, around creating a sense of community involvement, creating hope, aspiration and ambition, and empowering people to have choice and control in their lives. The limitations of what people gain were linked to issues around the use of engagement opportunities, and they also crossed into the what happens next section, which again came out as more aspirational. Teams reflected that actually service users did not really have visibility of how their contributions were used by services, and that this was a contributing factor to the frustration with the process of being asked the same questions time and time again. So overall, this activity led to questions around just how accessible are current process engagements due to things like transport, communication of information, digital inclusion in the current and digital inclusion in the current climate. And also just further highlighting that aspect of, are we using the right engagement methods right now? So due to the potential for this work to impact on both health inequalities and individual human rights, the iHub team worked in the background to complete inequalities impact assessment around this work. Because although our team will not have that direct impact on the experience of service users or their families or unpaid carers, it's still necessary to consider how health and social care partnerships work with the health and social care partnerships we work with, who are facilitating this change locally, identify and address inequalities when they're planning their engagement work. And this exercise was somewhat frustrating, but extremely useful in evidencing just how little detail we have data-wise about the impact of inequalities on people with learning disability and their families. There was a massive gap in demographics data for people who access day services, and very little recorded information about the number of people with additional protected characteristics. And in fact, all data we could find was really linked to people who are known to local authorities, but not everyone with a learning disability is known to local authorities, particularly those with more mild learning disabilities who don't meet the eligibility criteria for services, but who will still face inequality barriers on a daily basis. We also looked at what each of our project teams were doing locally, and only one team had done any specific equalities work around the redesign of day services. For everyone else, their equalities monitoring was part of a wider equalities monitoring in relation to their strategic plans, making learning disability data part of the overall disability data rather than looking at it in itself. And for 3 teams, there was actually nothing we could find on equalities monitoring at all. So this prompted us to think about recommendations for the future of the collaborative, which would involve including a question about equalities in the application for phase 2 to get teams thinking about this, working with other national organisations such as PAMIS and the Scottish Learning Disability Observatory to provide perspective and advise on equality matters for the collaborative, and also put in place an equality and inclusion working group for phase 2. Finally, the national team connected with People First, who hosted a focus group with their users around their experiences of support before and during the pandemic. And this was in response to the issues the teams were having around both suddenly having to question everything around their current engagement processes and strategies, but also their capacity for undertaking this work locally while their project teams were still actually in a very much a forming stage. But what we found with this focus group, and I think a link is getting posted in the chat to these findings, which are on our website, but what we found was that the findings confirmed and evidenced so much of what we'd heard from the teams already about people's experiences in that anecdotal sense. People were not being involved in deciding what should and would happen with their support in the current climate. And this is having a detrimental impact on their well-being and quality of life in a way that I'm sure that we can all relate to given our own experiences of lockdown, but which really deprived people with learning disabilities and their families of the support that they needed to feel happy and fulfilled in their lives. And so we're going to stop for another Slido section here. And what we're wanting you to answer is, does the experiences of our teams resonate with your own experiences of working with health and social care partnerships or service providers to listen to the views of service users? And maybe just give us a bit of context around how so. We'll just give you a couple of minutes on this. And again, thanks Stuart, links in the chat, and you can use the QR code. That's true. I guess I'm interested in terms of if they think, how they see it. Do they see it as informing, or do they see it as further up that scale potentially? I guess that's what the teams kind of went through. On one hand, thinking they were working in a way that actually complemented co-design and co-production, but actually when they dug a little deeper, they found, no, we're actually sitting down here at engagement and informing level of things. Oh, Claire, are you wanting to come in?
My mute doesn't want to play either, so it was myself that wrote that comment, Ashleigh, and I probably from a community engagement director and recent work we've been involved in. It's not just, unfortunately, in this area. Very often people think they're engaging until you kind of nicely nudge and push towards that. How do you actually, are you going beyond telling people what you're going to do, or are you actually asking for that and that feedback in? So I've seen it, most people are very open to it once you find a nice way to comfortably challenge that for them and get them to query it. very often people haven't even thought about it or considered it was information given rather than engagement until you do, in my experience.
Yeah, I think that's definitely been similar to what we've experienced with the teams, and there's that consistent thing that I've kind of seen where we go in with a plan already formed, and yes, basically you're going in and informing people and consulting on what their thoughts are on it, rather than coming in with a blank page, here's the problem, how do we solve it together. So yes, definitely a valid point, Claire. Oh, and plenty coming in the chat. I think that's a very valid point in there about people with learning disability needing much longer to consider information, and then potentially needing to pay for support to enable them to do so. That's absolutely. Oh, I've just realised that I can actually scroll down the comments on the slideshow screen, so that's made me happy. But no, thank you very much, guys. In the interest of time, I will keep on going with the presentation, but I think hopefully Alan's able to keep this poll running in the background, so please do keep your comments coming. It will really help us out when we come to the Q&A part of this. So, on to our key learning from this exercise. So throughout gathering all this insight and learning, we as the national team started mapping our discovery activity across the ISM behaviour model ourselves, kind of recognising that what we were doing with teams in itself and how we were designing this entire programme of work was in itself lending itself quite well to doing discovery around what teams in the system actually need right now. And also generally what we were realising quite quickly was that, and this is to quote friends, to be honest, that what we were kind of doing in having these conversations with the teams and getting down into what they would need to do around engagement work to pull out the details of what it is they need to change much more widely in their services was akin to splitting the atom and a whole mass of crap came out essentially. So after a lot of painstaking thematic analysis, this left us with the key areas of development that you see on the screen here. And as you'll see, the involvement of service users and their families underpins all other areas of development. There is significant improvement and redesign work needed around person-centred care, around working in partnership across organisations, empowering staff and creating inclusive communities, and also in supporting families to take a break. But ultimately, nothing is going to change unless we get better at actually involving people in how we deliver services. And we also identified key learning points for others going forward with this work. And a key aspect of this being that the current engagement and involvement strategies need to be understood and improved for effective discovery phase. And it should include scope for understanding the impact of inequalities on people's ability to engage. This is a complex problem to solve, and there really isn't one method that will be suitable for everyone. So hearing the voices of individuals with different lived experiences and perspective is essential to making informed decisions about the future of services. And even more crucial with this is involving them in making those decisions. The current lack of data around inequalities is also quite a big barrier, as teams can't actually change what they don't know is wrong, essentially. So if they can't actually find accurate data to go alongside what they're hearing from users, then it is going to be quite hard to pinpoint what they're doing right versus where they need to improve in that respect. And there was also a continuous question, and it's something that we'll come back to get your thoughts on in a minute, but when it comes to the point of creating inclusive communities, how much influence do service providers actually have over this? We can engage with people all we want, but how much power do they actually have in their role to make this happen? To help communities to develop to be welcoming and inclusive places for a person with a learning disability to achieve the aspirations of keys to life. And what sort of engagement is needed in this respect? Is it some kind of joint engagement between people with learning disabilities and people within their communities? How exactly do we go about facilitating that? So before we finish, well, not finish completely, but before I finish talking at you, I'm going to give you an update on where we are now. So we were commissioned for phase 2 of this work from June 2021 to March 2022, reducing the number of project teams that we were working with to 4. And all but one of these teams are planning or actually in the process of implementing new ways of engagement. They've been reassessing previous findings and the effectiveness of previous approaches, what they've actually gotten out of them. And they've also been planning in time and space to use communication tools such as talking mats with users with more complex communication needs, and trying to factor in things such as the length of time referenced earlier that people with learning disability will need to kind of take in questions that you're asking them and to think about their responses, and really building that into their planning and structures. Similarly, they're also thinking about the staff and having them trained and in place to be able to support people, and pairing up to ensure that, for instance, conversations can be recorded and mapped accurately, but also that the person isn't feeling like they're just having everything written down and being ignored while they're having the conversation. So looking at staff working in pairs to actually make this process work for people. We also have one team who have successfully recruited a person with lived experience to their project team, an acknowledgement of both the impact of what peer support and encouragement can do for others with learning disability, but also the importance of having that voice of lived experience shaping the way forward, and so actively participating in this work. And that's been a really interesting exercise, because it's really kind of prompted the team to think about their entire kind of structure and way of doing things. They actually, upon the person joining the team, started creating personal profiles for each other so that he could quite easily get to know them and be able to put names to faces more quickly. Similarly, it's now thrown up a question of the rights of that individual who's been part of the team, as he is currently the only unpaid member of staff doing it in a voluntary capacity. And so it's throwing up those challenges for them around, okay, that's maybe not sitting quite right with us. How do we go about making that different? And what can we learn about this process for future? All of the teams are actually planning to or collecting inspiring stories of people's experiences of new ways of working to both inform their own thinking and the thinking of other users and their families as well. Teams have also been completing baseline data templates constructed by our team to dig deeper into what information they already have around services, and connecting this directly to the keys to life outcomes. And all teams have been participating in our inclusion group, which was referenced earlier as one of the recommendations from our EQIA. We have our second meeting later this month, where we are exploring the impact of inequalities and the evidence the teams have for this, and ways of bringing these issues into the team's current discovery work. The teams are also contributing to our development of the EQIA for this work, and making considerations around their own EQIAs for local planning. And the first meeting of this group actually prompted some collaboration between ourselves, PAMIS, ARC Scotland and SCLD to develop design personas for teams to use in this work going forward. And we've also had our wonderful EVIT colleague, Christy Long, who has written a literature review, which is due for publication in the next month or so, which has a direct focus on the impact of inequalities on the lives of people with learning disability and their families, as well as pulling out new methods of working, both in terms of engagement and co-production, and also alternative delivery models for day support services. And so on a final note, I guess this work so far has created far more questions than it has answers, but that is the nature of being in the messy space of design. And hopefully, as we continue with phase 2 of this work, we'll continue to learn and be able to define more clearly what good engagement looks like in this context, before being able to work out what the future of day support for people with a learning disability can and should look like. So we're now on to our final Slido question before the actual Q&A discussion starts. But as I kind of hinted earlier, we're interested in knowing, where do we think the responsibility of service providers in addressing inequalities for people with a learning disability end, and where does the role of wider society begin? And we're interested to know any thoughts you might have of what the role of engagement might be in facilitating that to an extent. Oh, and very sorry, I have to nip to my door for 1 second. I will be back.
So any thoughts there from people? And it might be from working within your field, it might be from experience in your own community. One of the challenges that the sites have often referenced, and there's a lot of work being done around this nationally, is changing places, for example, having suitable changing places that aren't limited to only day centres. That's been the challenge across Scotland for a number of years.
Sorry about that. Got painters in doing my glossing. Guess we can leave this running in the background and go into if there's any other questions that people might have had, or if there's anything coming through in the Slido or the chat box during the presentation at all. Everything's coming in all at once. Wonder, does anybody want to come in with their thoughts? Perhaps anybody that's posted anything in Slido?
Hey guys, my system's playing up slightly, so I keep muting and unmuting and switching things off. The Liz Forsyth from Diffrees and Galloway, Ashleigh, I don't know if you've seen the thread, was just talking a little bit about access to training. So, and Alan's shared a link, but I just wondered if it was worth covering that while we're waiting. Other comments are coming in on your Slido.
Yeah, that could be a good idea. Alan, have you seen that message?
Yeah, so it was about use of talking mats, and that's something that one of the sites, or I think two of the sites, perhaps it is, that are talking about using that as part of their engagement with people. One of the interesting things that relates to that, but also a point I think Wendy made earlier about sort of real life stories. One of the key learning moments, I think, from the sites we were working with in the first phase of the collaborative was when somebody had coined the phrase Big Bang consultation, and it was through those learning sessions and when people really examined where they sat in terms of engagement, that they started to realise that, asking these closed questions for a fixed period of time might not be the best way to involve people. So that recognition that when you're in contact with people who are accessing a service every day, that there's all of those opportunities there to take that feedback from people. The use of the talking mats in particular is to again go out and have an open conversation with people about what they would like to do, and ultimately it comes down to how can everybody have the opportunity to live their best life, and that's the kind of very open, high level question that the sites are asking.
I guess on that note, it's also been, if you think about the team who have recruited a person with lived experience onto their actual project team, like I was kind of referencing there, they're actually having to do a lot of work around just questioning their ways of working. And like that point earlier about people with learning disability needing that bit more time to take in information, understand it, and be able to reflect on it. It's a case of them really thinking about how they even structure their project team meetings to allow that individual to participate fully and to actually contribute in a way that is meaningful for him. So that's been quite a lot of interesting conversations as well around just how they go about doing that. And I guess what we're kind of trying to encourage the teams to do in a lot of ways is to almost take a kind of, well, this is a design program, taking that sort of improvement lens to look at where they are working differently in terms of engaging and involving users in this process, to see what they can learn from it and develop maybe if there is some form of best practice around how to do this.
And just to pick up on Susan's question there, yeah, absolutely, please feel free to share this. We will be publishing the phase 1 learning report where a lot of this is encapsulated along with an easy read version of it just shortly, so we'll have that available on the website. I think it should be this week that goes up, so yes, by all means. Ashleigh, question there from Claire about supporting staff to overcome the perception that some of this might be too hard to do. How do you feel that's panned out with the sites that we're working with so far?
I feel like it's kind of a continuous process for us. We are that kind of support for them when it comes to this. There has been so many kind of aspects, such as even when you think about the analysis of it, and then having the capacity to actually undertake that and produce something, and then also host something that allows that, what their findings are for engagement, to be both disseminated to people and then bringing people back into the room to actually discuss those findings and what that might mean for the future. So I think it is this kind of ongoing process of taking them through each step, reassuring them, helping them to overcome certain aspects of it that are more difficult. I think one of the things that one of the partnerships ran into in particular was DPIA, which is always a fun one, data protection impact assessment, for anybody that's not had to do them before. And a difficulty around that is for us in terms of supporting the teams is that each local authority is set up differently, and so not be required of another team. So there's something about being very individual in your approaches. So one team I had to go quite in depth and help them actually work out how to do a full data protection impact assessment. Another team, it was literally just making sure they went through the ethical process of considering, of making those ethical considerations before putting into action what it was they were planning to do around engagement with people. So I would say kind of every day is a bit of a new day with it, and you've got to see what the teams are coming up with, what it is exactly they're wanting to do, and then work from there in terms of supporting them to undertake it. I think one of the advantages is that in some work, I guess, when you've got that potential to hear negative feedback, staff can be kind of worried or concerned. But one of the advantages I guess we have here is that the project teams we're working with know their services so well that actually a lot of the kind of negative aspects are things that they have already expected. Although I can think of one example where, for instance, all the kind of digital work that one of the teams had done over the course of the pandemic, even where they were getting responses from people who had engaged with that, those people didn't necessarily see that kind of digital work as support. They were still talking about when actually we get our support back and we go back to day services. So it was interesting. It's sometimes a case of kind of managing their expectations at points around what classes as support for people, what they perceive as support versus what the person sees as support. So there can sometimes be those clashes to kind of support them through and help them to know that it's okay to take that into consideration. It doesn't mean anything bad against you. It's just it's a fact of the matter for you to consider. Sorry, you asked me a question on this and I go off on tangents every time. But sorry, don't know if there's anything else you want to bring into that, Alan?
No, I think absolutely that covers it. I'm just going to post a link in the chat because a couple of comments come in the Slido response around what role everybody has. So to paint a very generalised and simplistic picture, quite often it's people don't know what they don't know. They don't know what opportunities are out there. They don't know how inclusive they are. And the National Development Team for Inclusion has this traffic light idea. It's drawn out in a comic style there. I think it's very descriptive of a sort of almost grading of opportunities and what's there, and it can then spur some thinking about, well, what might we all be able to do with the services that we run. And I know we might be sitting here as a bunch of professionals, but there's a load of services we engage with as well. So it's a really straightforward resource that prompts a lot of critical thinking and people are very open to it. It's not a threatening piece, it's not a scoring system, it's just something to prompt some of that thinking. So again, it's not our resource, but please feel free to signpost people to that too.
I guess on that note as well, somebody's posted in the Slido about Space Scot Edinburgh working to kind of bridge the gap between services and opportunities in wider society. I wonder, does the person who posted that maybe want to tell us a wee bit about Space Scot? It's one I've not heard of yet. Or you could post the link to it in the chat. I'm finding it quite interesting what's coming through in the Slido. It's almost kind of like this idea of the people who learn disability services, whether that's, I guess, public or private sector, being people to kind of almost champion inclusivity and inspire the communities. Seems to be the kind of general theme that's coming out of this. I guess I'm curious to know if anybody's done any sort of engagement work that has brought together both people with learning disability and people in wider communities together to discuss any sort of issues, or maybe even if you've done something similar in topics like dementia care or mental health.
There's a couple other points that might be worth expanding on. I'm thinking actually about some of the nuances and some of the aspects that I think many of us take for granted. So One campaign I mentioned earlier about changing places, where people in the room, not making assumptions of anyone's here, but what circumstances would you have your life dictated to by the proximity of a bathroom that you can use? These are sorts of inequalities that a group of people are facing. The Staying Up Late campaign is another one. At what point would you need to leave a gig or anything else just because your support worker finishes a shift? So there's some institutional, to do with service provision, inequalities that people face, and the big question even of day support. Why is it day support? And some of that links to the employment themes that were coming out in some of the comments there too. So there's a number of initiatives around that, and you hear people speak very vocally about everybody is employable, and employability is a strange concept to have, because it's not something. It's only rears its head when there seems to be a problem as such. So there is a lot of work going on with employers, separate agenda to specifically day support, but quite often that's where one of the biggest inequities is found in the percentage of people who are in paid work.
I'm sure you've both got half an eye on the chat, but there's a couple of comments in there if you haven't seen them already. Just one specific question from me, if that's all right. I was just wondering about the equalities monitoring data that you get in social care, what it's like, and if there's a common theme in terms of volume or quality. If you can speak to that.
Ashleigh, do you want to comment? I think we could both speak at length on that.
Yeah, I thought I chose my wording quite well in the slides, but it being a slightly frustrating process. But yeah, true. See, to be honest, there really isn't much. We kind of when you speak to teams, they know about how inequalities impact the people in their services. They can tell you about that and talk about some of the really difficult topics. In the inclusion and working group, we did have a really good conversation about that theme of people having relationships and what sort of difficulties they can get into there. There was one example of somebody who had actually managed to get married, and it got to the stage of them, sadly, it wasn't working out and they needed to then get a divorce. But because adult support and protection was involved so much, something that you or I could decide to do for our benefit and well-being, just quite, well, obviously not simply, but reasonably simply, got a whole other level of complexity for this individual. In terms of them deciding they wanted to get divorced, and that process took much longer for them. I wasn't too sure, it wasn't clear whether or not that issue had actually come out to be resolved. So that is such a difficult thing to capture, just how inequalities impact on life, and how do you even begin to measure that? And then I guess when you get into the aspects around actual statistics that you could measure, so looking at the number of people, for instance, who have an additional equality issue. Maybe it's race, maybe there's issues around their sexuality, not issues obviously, but maybe their sexuality being an equality issue. That actually is not really recorded so much within local authorities. It's quite difficult to actually pinpoint where the disability is a learning disability and perhaps race, having those two actually able to see the number of people with learning disability and race. Sorry, I'm getting myself muddled with words, but that's the general. There's not really easy data to pull out on that whatsoever. I had an additional point, but my head's went from it. Alan, do you want to pick up on any that I've missed?
Yeah, absolutely, and I suppose it's a question in how do we make this better. So that's one of the mechanisms we put in place, was to have those conversation-based groups and meetings to allow this stuff to come out, because there's no data source for this. It's very, very different to NHS Scotland. You've got Politics Scotland, get any data you want. So those things just don't exist in the social care field. In the sites, what was very interesting is even in the sites, some people struggle to access what should be, I think, in my formed opinion, fairly basic data on things like self-directed support. So somebody come back saying, "Oh, we don't know." Really bizarre situation in comparison to else. So I think, you know, there's learning here for his working in that space, and particularly an organisation that's so data driven and considers data, and it's as part of its sort of informal evidence hierarchy. You know, that's something we need to really critically challenge ourselves with, because the people who face the biggest inequities are least empowered to do anything about that and change that. So how do we make sure that these stories are not just palmed off as stories, but the experience of people is something that drives improvement, and the focus of where that improvement should take place?
Yeah, thank you both for answering that. Just a quick note to say as well, you were asking about the Space Scott resource earlier, Ashleigh. Kieran was trying to speak, but his mic wasn't working, so he's posted a link to that in the chat. So thanks very much for that, Kieran. Claire's also just asked a follow-up question on that. Ashleigh, what immediate impact does that have for you to not know a starting point?
Well, that's on us to go and find it, and that's why, you know, we've put these measures in place, and we've brought a number of third sector and topic specialist organisations in to provide the real narrative. Some of the things that are referenced most often, so there's the work that we've been doing, and the tools and the frameworks that we've used, you know, referenced and used by the teams. But the stuff that comes up time and time again is when you've had a parent carer tell you what COVID was really like, that story stays with people, and that's significant. And, you know, we go to some lengths to make sure that, you know, the voice is there. Albeit, you know, there's surveys and national things that we relate, and we share that, and sometimes the impact of that gets lost. And it is a balanced view, because we have, as I say, some of the organisations we've brought in have been able to show that the move to digital connectivity for some people has provided better outcomes for some people. I'm not saying all people, some people. It's provided safety, that there's been sort of recognition of protection issues that have stemmed from some of that. So it's not, there's never a one side of a coin with any of the work that we're doing. So that's probably the biggest challenge, is how we then present it as a balanced view. But people have been looking for these changes. As you actually said, the strategy there from 2000, so it's been 21 years of that strategy, and those ambitions have not been met. We've had the strategy in 2013 and the plan since 2018. And that these things are still challenging, and they're challenging because they'll continue to be challenging. And probably the other impact of some of that, not entirely, is that we're working with a smaller group of partnerships now. So we went from 8 to 4 into phase 2, because of the size of the task and capacity locally as well, and just being able to try and drive the biggest impact. But certainly the starting point was always there, and it was clear in the strategic direction nationally, but challenged in terms of doing the deeper dive. So, you know, Ashleigh's work, your work in the using the ISM model, I think really opened a lot of people's eyes into how to target particular areas of where those challenges are. Is there anything you'd add to that?
Yeah, I think I guess part of what our work is doing as well is around that building people's capabilities to be able to effectively use the evidence they have, and use that in a meaningful way to inform things going forward. Like Alan kind of referenced earlier, the teams know this information, they are capturing this information, but the problem is that it's mostly in their heads right now, rather than any formal setup to be able to record or use that in a way that actually helps them to evidence why change is needed or what change might be needed. So there's something thinking about this when we're talking about using the inspiring stories, also using stories that are inspiring in a way that's because you're so upset with how the current process works. So showing how things aren't working right now and highlighting those pain points in the system, using these stories of how inequality has had a negative impact. And like Alan referenced as well, we saw that at national events where we had PAMIS speaking and telling a really powerful story about a carer's experience. And it wasn't even the carer's specific, it was her experience of her younger daughter. So her son had a learning disability, a profound and multiple complex disability. And her younger daughter was about 6 years old and already asking her mum, who's gonna take care of him when you go? Is that my role essentially in life? And so there's that impact of looking at families as well, and how the way support is set up right now will actually impact on them. And interestingly as well, it actually brought out a carer who was attending the event as well and shared her story about support for her son with complex needs during COVID, and how his well-being had really significantly deteriorated without having that sort of connection that he was used to having with his mum over the course of the pandemic. And just hearing that really resonated with teams, and we're still finding now that the teams are going, yeah, we need to connect him with PAMIS, we need to connect and with the work around profound and multiple learning disabilities to better understand how to work with people and to ensure their voices are heard. And sorry, I did notice a question in the chat section there. Sorry, Jamie, in answer to your question, so we had an application process in place, which teams completed the application, we reviewed, and they were either accepted or declined, whether or not they met the criteria. I mean, phase one, I would say it was a lot wider. It was more just them needing to have that interest and wanting to undertake this design-led piece of work. Phase two, based on what we learned from teams, we did tighten that criteria. So for instance, the reference made to putting that question in there about how they were considering equalities. So questions like that around it, and also asking them directly what sort of engagement work is it that you're planning to enable this discovery stage as we moved into phase two. Don't know if you'd add anything to that, Alan, but sorry, Claire.
No, I pasted someone in the chat as well, so no, nothing to add there.
That's great, thank you. I think there might be one other question there as well from Liz.
Oh.
Yeah, I have to take that. So no, it was a closed process for the time invested in the initial 8. We're obviously on a particular fixed term resource to deliver this work, so we wouldn't be able to go back, but would encourage people to have a look at the website and catch up on the resources, the national events. We have a number of in-house, call it that, within the collaborative sessions as well, that's open to the full 8 teams from phase 1. So our next national event will be the 16th of December. That's open to anybody. These are outward facing, and it shares some of the findings from the collaborative. We also invite input externally as well. So there are opportunities to stay in touch, and we do engage through the cross-party group for Learning Disability, the Social Work Scotland Learning Disability and Autism subgroup too, so we keep them informed and we're able to share our progress through there.
Thank you very much, Alan and Ashleigh. Hopefully we're just on time. My door went just as I was about to come in, as you probably noticed, so there's obviously a morning for busy doors, Ashleigh, it's not just you. Thank you so much, that was absolutely fascinating. There was a lot of information and data in there that I hadn't heard before, so it was really, really helpful, and I absolutely, there's some brilliant resources. So they're obviously in the chat, and once the recording is finished, it will be put up on the website as soon as possible with any other links that we can. We'll be more than happy to do that. Stu's putting in that we're getting that in, which is great. I think I just want to do a thank you to Alan and Ashleigh and a blatant plug for next week's session. This is a 2 out of 5 sessions. So next week we are looking at 2 programmes that have been involved with people with lived experience of dementia. And the presenters are going to focus and look at the challenges and ensuring that people with dementia are engaged with meaningfully, which I think feels very similar and resonates with what we've discussed today, and describe the impact that it can have to address these challenges. Thank you very much. If you have any queries, please use the chat or get in touch with our colleagues. I think the link's going in for our colleagues about what we have and information if they want to find out about the future sessions. Thank you all. Have a lovely lunch, and thanks again, Ashleigh.